Good evening. How's everybody out there? This is Dr. Soliman, Saturday at 5 o'clock, and your Health Today with Dr. Soliman. We will discuss part 2 of women sexual dysfunction today. We didn't take much time last time because of the circumstances, but today we intend to cover the remains of the topic and share something else with you. We spoke the last session, the last week, about women's sexual dysfunction, and we said that even though 1 out of 3 women have sexual dysfunction, it is a lot less pronounced when compared to men. Men talk about it, the statistics are there. Women are very much shy of talking about it because of culture and religion reasons. Nevertheless, like men have sexual dysfunction, women also have sexual dysfunction. And we said the anatomy when it comes to sex is very much similar, except for the penis in a man is very much noticeable. But in a woman, the similar structure would be something called the clitoris, which is right on the top of the urethra where you urinate. So that is the clitoris. And we said, like men, the whole key of sexual excitement is blood flow. If you have limitation to the blood flow, you will not have good erection. By the same token, if you have limitation to the blood flow, to the pelvic floor, to the woman, you will have also sexual dysfunction. And we categorize, and I like to repeat, the women's sexual dysfunction, just like men, are divided into 4 categories. We can have a problem with desire. Desire meaning, the head. Something is wrong with desire. That means something is wrong with the head. What could be wrong? Psychological reasons. Psychological reasons like low self-esteem. She does not feel good about herself. She looks in the mirror. She sees that she is too fat or too skinny, or this is out of shape, or that is out of shape, or the hair looks like this, or the nose is too big or too small. This is low self-esteem. You are not confident about how you look. You as well cannot take the idea, what if I take off my clothes and my husband will see my breasts? That doesn't look too good. Well, those are all things that disturb. Those are all things that disturb the esteem, the confidence level of a female to have sex, good sex with a man. So low self-esteem is one of the psychological reasons that a woman will have low desire, hypoactive desire, okay? Like men, when a man feels threatened, and this happens when the woman is more experienced than the man, like she had ex-boyfriend before, and some of them are not really in full mentation, and they like to speak about their previous experiences, and the man feels less of a man, and he feels threatened. And that is one of the most common psychological reasons for male hyposexuality or sexual dysfunction or impotence or low erection, weak erection. So, and I get a lot of those young men with sexual dysfunction. A woman applies the same thing. So we all the same when it comes to sex, men or women. We may have different fat distribution, different anatomy when it comes to the reproductive system, but psychologically we both the same. Men, when they feel threatened about their manhood, that they are less of a man, he cannot erect. A woman, when she feels threatened or she feels not comfortable with her figure, the breast is too small, the breast is too big, the curves are not appropriate, the face doesn't look too good, the hair doesn't look too good, she is not confident about how she looks, especially when she takes off her clothes in front of a man, she feels not comfortable. So when you get that feeling, obviously the next step is you will not have a good sex. This is what we call desire disorder. Desire disorder. So desire disorder is all about psychology, your self-esteem, your level of confidence when you are with a man. You don't feel as you will satisfy that man because you have defect in this and you have defect in that, and that the man is going to look at you negatively and he's going to give you a negative feedback, and this is all playing in your head. So you are confused. Should I have desire and continue with having good sex, or should I be thinking, what is he thinking about me at this moment? And this fight that is going on in your head will definitely affect your desire as a result of your low self-esteem. So the management in this case is what? The management is psychotherapy. What is psychotherapy? Communication between a sex therapist, somebody who knows those problems and can treat and deal with psychological problems, and the couple. Not each one differently. No, they have to be together. So we discuss the psychological problems that affect the man and affect the woman. So it's about communication. Psychotherapy is nothing but communication and touch the weak points. A therapist will recognize what is the woman's points of self-esteem and how to manage that. There is a psychotherapy, behavior modification therapy that we can do to bring the self-esteem up, to bring the level of confidence in that woman figure, how she look, how she speak, her personality, will bring it back up. Once the woman have confidence about how she looks, how she speaks, how she reacts, how she responds sexually, then the sex will be much better. Not only for her, for the man also. When a man have a good sexually responsive woman, he has everything he needs. So sexual response in the woman part is a main let's say principle, okay? It's something that is very important when it comes to successful relationship. A relationship without good sex is a very fragile relationship, right? We all agree on that. So this is the desire disorder. What else can we boost the desire in this woman? Well, there is, like we said, testosterone can boost the desire in a man. Testosterone also can boost the desire in a woman. Well, we have to be very careful when we say drugs names, because I am not saying that so you can go and get this medication or this or that medication. No, it has to be very carefully calculated. Why I'm saying that? Because if you take an extra dose of testosterone, you bring in the worst. And I've seen patients, testosterone is very high, but yet they have an impotence and they caused a lot of damage. We will talk about that also in a bit. But so that means only a doctor and only a good laboratory results can tell me if you need testosterone or not. And I'm going to give you some scenarios whereby testosterone is good or even high, yet the desire is low. There is other reasons. So now, if I say testosterone is good for those who are low in testosterone. Testosterone also is good for a woman to bring the desire up, but if she needs it. So when I say medication, doesn't mean that you go out there and look for the medication that I say. Everything has to be carefully calculated and everything is adjusted by dosage, and only a medical professional, a licensed medical professional, can advise you take this and not take this. It is not like on a sidewalk where you go buy some medication and you think it's going to work for you. It doesn't. It actually causes a lot of damage, and we're going to discuss, a real case that I just encountered a couple of days ago. I will share it with you after I'm done talking about women dysfunction. Now, so this is the desire disorder. So we're going to boost it with two means. If it is because of physiological reasons and is because of lack of low level of testosterone, whether men or women, we're going to boost it up by giving some testosterone based on the findings of how is your level of testosterone, not random. Now, Psychotherapy is very important because we're gonna fix the problems that make this woman not very comfortable of how she looks with the feedback that she will get from her husband. There are many issues, communication and good sexual therapy, good behavior therapy, and as a good sexual therapist will be able to address the problem in 1 or 2 sessions, and everything is clear, and the couple can practice their sexual life, healthy sexual life, very comfortable, and the relationship will be even a lot more stronger. So there is no need to look outside the relationship for somebody who will give us satisfaction. If the wife can give you satisfaction, and if the husband can give you satisfaction, full satisfaction, there is no need to look outside the relationship. Why I'm saying that? Now let me, before I forget, I got few questions, and they both, and those are recent questions, even though I have addressed them before, but you know, they all about the same thing. Doc, you know, I am pregnant, but you know, did I get pregnant in January or I get pregnant in February based on calculating the ovulation date? Why did she ask that? Well, some of them ask you like this, and some of them come straight and tell you, listen, I have sex with guy number 1 this month, and I had sex with guy number 2 this month, and I'm now pregnant. Is it guy number 1 is the father, or guy number 2 is the father? And some like to play smart, and they say, okay, you know, but anyhow, the doctor understands, you know, just by you saying, you know, so it's advisable to be very open and very honest with the doctor, because every piece of information you say, it means something to him. So you have to be very open and very, very honest on what you say, because that will help you. The doctor is not a judge, is not a policeman, is not a detective. His main concern is your health. So the more open and honest you are, the more accurate the diagnosis would be, because history is a very important part of establishing a correct diagnosis. Now, answering to those questions, because I have like few questions around the same thing. We know how to calculate the ovulation day. We did it before. We will not do it again. Watch my videos, and whether on my Media Prime page or my Facebook page under Dr. Soliman Clinics and Labs, all the tapes, all the videos are there. You can go, and everyone is titled. You can go and search. Like I said before in one of the sessions, I have mentioned that like you have memory cells in the brain, you have also memory cells in your heart, and you have memory cells in your uterus. So there is memory cells in the uterus. What is the function? What will those memory cells in the uterus will remember? Well, what gets into the uterus besides sperms? Sperms. So this uterus, this memory cells inside the uterus, they can memorize the sperms. How are they going to memorize the sperms? Let me give you a small analog. This is a fingerprint, right? Not two people having the same fingerprint, right? It's different. The same thing, the sperms. The sperm don't have fingers, but they have what is similar to a print. What is a print? You know, each sperm is made of genetic materials, right? Like DNA. So now this genetic material is composed of bases and nucleotides and some parts. Let's call it parts. Now, let me give you a small example. I have number 1, number 2, number 3. Those are 3 numbers, 1, 2, 3, right? I can put it in this order, 1, 2, 3. That is one sequence, one order, like that. Now I can put it 2, 3, 1. That's another sequence. I can put it 1, 3, 2. So I can change those only 3 numbers. I can change them in so many ways, so many arrangements that are different one from another, yet they are the same. Number 1, number 2, number 3. So the order has a change. And that is exactly what we call sequencing. So if I change, that is one guy have a specific sequence that the uterus will memorize. If you have sex with a different guy the following month, now the uterus is confused because he's only used to memorize that sperm with that specific sequence. The genetic coding of that sperm is being memorized by those uterus cells. When I confuse the uterus with many other sperms from different other men, what do? I confuse the uterus. Is that good for the uterus? It's very bad. Why? Because the uterus now is confused, and that is the onset of many diseases. Some of it we know and we can treat, and some of it we are yet to know. We do not know yet. You understand what I'm saying? So now, So what is the solution? Be with one guy at the time. Be with one guy at the time. If you want to change guys, allow 3 months and 10 days break between one guy and the next guy. Why is it 3 months and 10 days? Because this is how long it takes to make new memory cells in the uterus. The old cells will die off, new cells are being made, and now you have a new guy that will remember, the new guy with new sperms, that this new memory cells in the uterus will recognize those new sperms. Okay, so and this is researched and has been confirmed by scientific evidence, and I'm not talking from space. I'm talking about based on scientific evidence. Okay, medical scientific evidence. So it's recommended, strongly recommended, that if you're going to change guys, then you have to allow 3 months and 10 days between one guy and the next. So when you have different sperms coming in every 1 week or every 1 month, you're confusing that uterus, and that is an invitation for dangerous diseases to set on. Okay, I'm not going to name, but many diseases, the uterus get confused, and you know, you will have a bad uterus, and you will have a bad diseases. Okay, yeah. It has been now researched why we have so much fibroma. Women with multiple partners without a break, you know, it can also be a reason. It's under research, but it has not yet confirmed. Anyhow, those data are valuable online if you like to confirm anything that I have said. Anyhow, those are medical research that has been studied and approved. So my advice is, this is beside, you do not know. You're gonna, you will have a child and you do not know who's the father. And you will say, okay, maybe the father is the one I slept with in January, or maybe the one I slept with in February. Does that make sense? It doesn't make sense, because now science is very advanced, and very soon DNA testing, parenting testing will be introduced into Cameroon. I'm quite sure it already exists, and very easy to know if this is the father or this is not the father. And there's many cases that we have encountered that the father is not really the father, right? So now, nevertheless, so summary, uterus have memory cells. Advice, have a break. If you're going to change guys, have a break between one guy and the next, not less than 3 months and 10 days. Okay, now we finish with the desire disorder, and we mention what to do. Whether if it's physiological, we're going to give testosterone. If it's psychological, and this is the most commonly existing, between whether it's a man or a woman, then the psychotherapy and counseling by a sex therapist will be the optimal, and you will get a fine resolution. The next phase of our sexual dysfunction, men or women, is arousal. What is arousal? Excitement. So what is the hallmark of this phase? In a man, you will have erection. In a woman, you will have lubrication. The vagina becomes wet. I got those questions from the last session. Doc, I have sex, but is no lubrication. Even though I'm excited, but there's no lubrication. So I told her, check your glands, massage the sides of the vagina. This is the Bartholin glands there. Massage, maybe the canal is clogged. If you feel a small swelling on the side of the vagina, that means the gland is clogged, because those glands are the one responsible for secreting that lubricating material, okay? That mucus material that is being lubricated from those glands. Massage the side of the vagina slowly in a circular motion, and if it's clogged, it will be unclogged. Sometimes we have issues in those glands on the side of the vagina that this place becomes a swelling, and that was also another question. Do not worry, it's a very small thing. Unless you ignore it for long and it becomes so big and it collects pus, then in this case we have to aspirate or incise and drain it out. How we know which procedure we will make? By simple ultrasound. Ultrasound will show me what kind of fluids are there, if the fluids are free fluids, easy to come out, or the fluids are semi-solid that require us to open a small incision and drain it out. Ultrasound tells me a lot of things. a lot of things. But if it's a small swelling and you are dry during the arousal phase, could be one of the reasons. One of the reasons. Now, also, ask yourself, have you had a cold and you've taken antihistamine for that cold because you have a runny nose? Have you have this, let's say, this tablet before you had sex or a couple of days, or you've been taking it for the last couple of days? That's also could be another problem, because antihistamine dries you out, and including the vaginal lubrication. That is why you, during excitement phase, during the arousal phase, you cannot get wet enough because of the drug you're taking. So look at the medication that you're taking and read them and see if they interfere with, the lubrication phase. Especially we're talking about the antihistamines, that medication you take when you have a cold, okay? When you have a cold, that is called antihistamines medication. It has antihistamine in it. Now, we also mentioned before, we said, impotence or sexual weakness could be a sign of depression, right? We said it could be a sign of depression, and most likely it is a sign of depression. And we treat depression with antidepressant. And here's the news. Some of those antidepressants that you take, if you don't go to a specialist or to a doctor who understands, some of those antidepressants in themselves, they cause sexual weakness. Some of those antidepressants that you take for depression cause sexual weakness in a man and a woman. So what is the solution then? You said sexual dysfunction is a sign of depression, and we treat depression with antidepressant. And now you're telling me antidepressant could lead to sexual dysfunction. So what is that? Well, there are groups of antidepressant. If you care about your sexual function, then we will give you an antidepressant that does not interfere with sexual function. But if you, an old person that gave up on sex, don't have sex for years, then it doesn't matter in this case, which category of antidepressant would choose. But the doctor would know. It's not you to know. The doctor would know which class of antidepressant that will be good for you and does not interfere with the sexual function, whether a man or a woman, okay? Now, so we say, if you check, you're not taking antihistamine, you're not taking antidepressant, and the glands are all fine, there is no problem with the glands, and you're still dry, then maybe we can use some lubricant, local lubricant, okay? And remember, if you are taking the birth control pills for sometimes, it causes also some kind of dryness. It causes some kind of dryness. And we said the best solution also, to very simple solution, is we put that estrogen pills. A lot of people, where can I get estrogen pills from? You go to your doctor, explain the problem, the doctor will give you. The doctor will write it for you. It's not like you're going to find it on the side road. Maybe in Cameroon you find it on the side road, but it's not good. I get men, okay, and I will discuss it now before I forget, because I know I'll forget now, that's in my head. I got some patients, okay, and doc, Viagra is not working for me anymore, and I don't like to be in Viagra because it gives me this, it gives me headache, it gives me this, it gives me that. I said, okay, just out of curiosity, how much did you pay for that Viagra? Oh, 500 francs. For how many tablets? For 4 tablets. That's 125 francs for a tablet. I said, what Viagra is that for 125 francs a tablet? You bought it from a pharmacy? He said, no, not from a pharmacy, from, So, okay. Well, I did a hormonal test on that guy that he bought it from, the side road. And I did a hormonal test on him, and his FSH, as I remember, his FSH was high, testosterone was normal, and LH was normal. So he only got high FSH, normal testosterone, and normal LH. You know what that translates to? Translates to spermatogenic failure. The testes are there, is making the testosterone, but there is no spermatogenesis. There is no sperm. You cannot make sperms. And most likely the reason is those Viagra. That is not Viagra. I'm sure it's not Viagra. It's something else that destroyed the guy's testes, and they call it Viagra for 500 francs. I mean, there is no Viagra for 500 francs for tablets now. Never existed. Not even in a different planet where they have everything for free. It doesn't exist. So know what you're taking. Take the package, Google it, and see where it's coming from now. I'm quite sure it's fake. Anyway, this is just one of the, a lot of you know about the 4 tablets Viagra for 500 francs. A lot of you do, because I ask a lot of patients. They all have the same thing. I cannot take phone calls. Please do not call. I will try if I get time to answer the questions, or I answer them in the next session. Okay, so let me move to the next phase. We said there's 4 categories of this, of those sexual dysfunction, men or women. Now we have orgasmic disorder. What is orgasmic disorder? I cannot reach the peak of pleasure when I'm having sex. Some women, I never had an orgasm. I do not even know what orgasm is. So if we say communicate with the husband about your, remember we said once, a good communication, which is I talk, you listen, you talk, I listen. This is called communication. A good communication about a man and a woman, is very essential for the success of a relationship, sexual relationship, right? So you tell the man, this is what I like and this is what I don't like, and the man tells you the same. So what if you don't even know what you like? If you don't know what orgasm is, what orgasm feel like, that means you have never known where is your sensitive spots, where the man's supposed to touch or manipulate, or you don't know because you have never experienced an orgasm before. So now what is the next step? What should I do? Well, it's very simple. You have to be aware yourself of your sensitive sexual spots, or we call it the G spots, or the spots that arouse you the most. You have to be familiar with, and then you'll tell him, this is what I like and this is what I don't like. But you do not know what it is, then it's not. If you yourself do not know where it is or how it's supposed to be exciting you, then how would he know? You cannot even communicate because you yourself don't know. So what is the solution? The solution is, I said everybody masturbate, no? But it has to be to a limit. It has to be to a very limit. You cannot exceed, otherwise it will be pathology, right? So during masturbation phase, you will know what is the spot that gets you on the most and what is the most sensitive spot for you. And this is what you communicate to your man. And you cannot be shy. And the man also cannot be shy because you both at one. It takes both of you to have a successful sexual relationship. So if I hide my likes and he hides his likes, we're they're assuming. And the next step will be, I'm with my man, but fantasizing about someone else. And he is with you, but fantasizing about someone else. So this is the beginning of the disaster. If it continues for long, the relationship will not survive long, right? I think you know what I'm talking about, and everybody now having in their head exactly what I'm talking about. You're probably saying to yourself, oh yeah, you're right, doctor, you're right. This is exactly what's going on. I know. So now, what is the solution for orgasmic disorders? Education. Education. You have to have education about how to have an orgasm. And we said the difference between a man and a woman is the woman is multi-orgasmic. She can have multiple orgasms during one sexual intercourse. And the best thing to have the woman have multiple orgasms is the foreplay, the arousal phase has to be extended as long as you possibly can. The man as well. If you have a premature ejaculation, we told you that there is a medication you take to prolong the ejaculation, but this is not what I want. Because like I said, sex is all above the shoulders. Sex is in the head. So what can I do to have, delayed ejaculation, to take my time when I'm with a woman? Well, we're gonna help you with one of those tablets you take before sex, okay? And that will delay the ejaculation. That will delay the ejaculation. But meanwhile, you have to be conditioned. Your brain has to be rewired, to delay the ejaculation. Like I have mentioned, ejaculation, fast ejaculation, premature ejaculation, fast discharge, all the same thing, is a learned behavior. You have learned during your past years and past experiences to ejaculate fast. for one reason or another. Maybe out of fear, maybe out of too much anxiety, maybe you're afraid this will see you, maybe they're afraid this will hear you. For whatever reasons, your brain has just learned to ejaculate too fast. So what I'm going to do with you, I'm going to give you one tablet that will delay ejaculation till you condition your brain not to ejaculate fast. How is that? The tablet will give you prolonged period, delay the sexual intercourse with your woman. Meanwhile, you're going to practice what is called a stop and go technique. What is the stop and go technique? A stop and go technique requires you and your wife to be together because you will practice the stop and go technique together. When the man is about to ejaculate, he stops, he comes out, and the female squeezes the head of the penis till no blood is there. Then you go. So it has to be successful communication between the man and the woman. I'm about to, okay, you come out, then she does it. So it's communication between both. She controlling her orgasm, he is controlling his orgasm, not to ejaculate fast. Can this happen at the first setting? Impossible. It requires training and conditioning, and after this you will not need the tablet anymore because you can control the timing in your head after successful completion of this practice, the stop and go technique. Stop and go, stop and go. Who controls the stop and go? The female. So the female has to know. You cannot do it in secret. Oh, I'm doing it behind her back. Doesn't work like that. It takes two of you to understand the technique, understand your needs, understand the problem, and then both of you will work on solving the problem. That is the stop and go technique, and that is the best treatment for premature ejaculation. The tablet and the medication we give you is just to help you. Help you with what? Gain confidence that you can do it, and then you will do it. 1 time, 2 times, 3 times, 10 times, 20 times, 50 times, it doesn't matter. You will get there. You will get there, okay? You will get there. Now, second thing is we said about erection, man or a woman, excitement, the arousal phase, relaxation. You know, your nervous system has what is called parasympathetic and sympathetic. You have to be in fully parasympathetic. In simple English, you have to be fully relaxed, no stress, leave work behind, leave all the stress in your life behind, and focus now. We're going to have pleasure moments, me and my wife, and we need to be very relaxed. Now, Doc, can I take some alcohol to help me relax? Well, you think you're going to be relaxed with alcohol, but alcohol, initially, it gives you inhibition. Alcohol gives you inhibition. Inhibition means what? You don't really care about anything. And initially, also, it gives you good sexual performance and delay. Like tramadol, it gives you the same thing. Initially, at the beginning, it gives you that, okay, I'm taking tramadol, I can delay the ejaculation, right? Initially. But once you do it too much, now it causes really bad impotence. So I like things to be natural. Natural. Alcohol is an enemy of sexual function, good sex. Tramadol is an enemy of good sex. Initially, you may use them and you will have fun, but the problem is addiction. You use them once, twice, 3 times, 5 times, you're already addicted. So you cannot do sex without tramadol, and you cannot do sex without alcohol. You understand what I mean? And that will turn against you. That will turn against you. So do it natural. Do it natural. If you have fast ejaculation, we'll help you with that one tablet till you condition yourself. And now both of you, husband and wife, you know, you have to practice this together. And at one point, you will be able to control your timing together. You cannot have orgasm and your wife haven't even just about or didn't have or doesn't know what orgasm is. This is a failure in a sexual healthy life. It's a failure. So you have to adjust yourself. The wife has to be satisfied. And satisfaction of the wife is about understanding each other very well, communication with each other very well, even to the point that this is the point where I'm going to have an orgasm. You have to understand both. That, okay, we do the stop and go technique like the doctor say, and everything will be okay. Okay? It will take time. Please, I cannot take calls. Do not call. Send me a message, and hopefully I will have time to answer a couple of them before I go. So we understood, right? We understood. A good sexual, healthy life is about communication between a man and a woman. Now I get a lot of questions, you know, Doc, I have a micro penis. My penis is very small. And I tell you something, you know, the size of the penis is the last thing you need. You only need it at intercourse. But the foreplay, the arousal phase, the desire, everything else has nothing to do with the size of your penis now. All the phases that you have just mentioned has nothing to do with the size of your penis. If you have a, you know, normal size penis, it's okay. If you have less than normal, it's also okay. Oh, can I do a surgery, doctor? What medication is available for that? There is no such medication available for that. All those ads you see on Facebook and Google or on internet in general, or here on TV, not here on this TV, I mean other TV channels, oh, this, take this to do this and take this to do that. This is all fake. There is nothing can lengthen, increase the length of the penis or the diameter of the penis, except only one thing, which is, you know, surgery. We cut the ligaments for the penis, okay, and then that will give you about 4 centimeters length. And it's a surgery that is only done by a professional surgeon that knows what he's doing before you lose the whole thing. So, you know, do not have yourself hooked on the idea, my penis is small, I cannot have sex. This is what we call psychological reasons for impotence, for sexual weakness, because you strongly believe that the size of the penis has a lot to do with your sexual performance. It does not. It does not. You can keep the woman happy without even, you know, a penis, right? I mean, I'm not talking about, eventually you're going to have sexual intercourse. Let me give you an example. Those guys that are 100 years old and, you know, they have complete failure in erection. We insert implant inside the penis with a small vacuum on their side. They press the button, they get erection. They press it again, the erection goes. Now, with this mechanical erection, the implant that we put in their penis, and they have erection or no erection. By the way, it's 96% success. Those who tablets didn't work, other means didn't work, injections didn't work, we have a last resort, which is the implant. We put an implant there, and with a small button in your size and your waist, you control erect, no erect, erect, no erect, okay? Okay. This is mechanical now, right? So they have very good erection. This is implant, okay? It's successful, it's very, very much successful, and satisfaction is to the max. You know, they can, you know, they just erection now, right? So can these really satisfy the woman? Yes, some sort they can satisfy. Can they ejaculate? Most of the times, no. Can they have an orgasm? Most of the time, no. So what good is it? He gets the pleasure from his woman having the pleasure. I get a lot of men, oh, I'm just doing it to satisfy her. And how you get your pleasure? Because she's satisfied. So if she's satisfied, I'm satisfied. If she's satisfied, I'm satisfied. A good responsive woman will give the man pleasure equal to orgasm, okay? Now we're going to go to the last phase, which is the pain phase. And we discussed this the last time, but maybe quickly. The pain phase is, for example, a woman that is, you know, have a dry vagina. Like who? Like a lactating woman, for example, and a post-menopause woman. What is the common thing between the two? Low estrogen state. A lactating woman has a prolactin that is high. A prolactin that is high. While the post-menopause women have failing ovaries. The ovaries have failed, and the ovaries are the source of estrogen. So if I have lost the source of estrogen, I have low estrogen state. And if she has high prolactin, that will be working on opposite direction to her normal estrogen. That means the prolactin inhibits, decrease the estrogen. So we have equal states. We have one ovaries failing, that's why you have low estrogen, and we have the other lactating woman, estrogen is low because of the high prolactin that is responsible for secreting the milk that the baby suckle. Okay. So what estrogen has to do with anything? Estrogen is very important to the sexual function, very important, because it has to do with the blood flow. Estrogen increases the blood flow to the clitoris, to the pelvic floor, and as a result, when I increase the blood flow, obviously I'm increasing lubrication. The glands that's in the vagina secreting those mucus needs to eat, and their food is blood. So if I increase the blood flow to those glands, they will work better and they will function much better and they will increase their mucus that they secrete and the vagina will be wet. So if I fail to lubricate, then I will have pain, then I will hate sex, then I wouldn't even want to think about sex when it's accompanied by pain. But there is also psychological reasons. For example, men. Some psychological disorder, men think that the vagina has teeth. And if they go inside, the vagina with the teeth can cut off the penis. This is a psychological disorder now. So you have now to stay and do behavior therapy and psychotherapy and convince that poor guy that the vagina doesn't have teeth and nothing is going to happen to you when you enter the vagina. We have also what is called, when the pain is too much, the woman learns to contract the outer third of the vagina. That is very difficult to penetrate now. Even with a hammer, you cannot go inside, because she is contracted so bad, nobody can go, nothing can go inside. So this is, with again, psychotherapy and behavior therapy and, a little bit of techniques, small techniques that we, but those are the extreme cases, they are rare cases. They're not so many. So we're not gonna spend time on rare cases, on things that maybe you have never seen. Some of the times because of religious reasons and religious feel of guilt. Some things like this would happen that is manipulated or that is generated by the head, but it's not real. It's generated by the head. So, I'm getting few minutes left. I had a video to show you, but I think I don't know if it's going to allow us some time. Let's just play the video, please, Mr. Vola, and we'll.
I can't remember this shout. I used to shout at midnight. But the thing passed me because I shout for midnight only one time for 1 month. But today night I shouted 4 times. And when I shout, I go toilet. I piss over. I expect. In the morning I be confused a bit. Yes. Then I weak. My skin weak.
Do you remember when you wake up after the shout? Do you remember that you have shouted?
Yes.
You remember?
Yes. Even when I shout the first time.
Yeah.
I don't know the time when one start. But the second time I know when I want to shout, I look my
Do you eat in your dreams?
No.
You eat? You eat in your dreams?
Yeah, I used to eat with my dream. But yesterday, then.
Before yesterday,
yes.
Did you eat in your dreams?
No, I used to eat too much.
Too much? Not too much?
Is that sick power? I used to see it too much.
Yes. So do you have sex in your dreams?
Yes.
How often?
Too much.
Translate for her. How often?
How many times will you get sex with your dream?
If you plan this on night, I've always seen a baby. When you find me, I didn't like him. When I woke up, I asked my husband, I don't do so. But I don't want to catch my husband. Let me know if I not one sec. When you want to do it for me, they beg. So then they take my power.
She doesn't, you understand me? She doesn't like the husband to make love to her.
She only likes those spiritual ones.
Yeah.
So listen to me very carefully now. Do you like or you enjoy the sex with your own husband or no?
All right, so this is a case that she shouts. Please play the next video. And she had the attack right there at the hospital. And I'll explain to you in 2 minutes. I don't know if we have just the second video ready. If not, yeah, here it is.
Can you hold this for me? What's wrong?
Okay, this is briefly in 2 minutes. That's an epileptic case that is spiritually induced, okay? We can also have abnormal EEG in this, but definitely it's a spirituality disorder, has to do a lot with it, actually. If you see, I looked when she had the attack there. I was very lucky because they never videotaped the attack. My advice to you out there, if you have somebody, a friend, a family member that have any kind of those attack where he fall down like that, I want you to make a video And in the video, I want you to look at the eye. Does he have the attack with the eye open or the eye closed? That makes a lot of difference because there are 43 types of epilepsy. Some of them is psychogenic, is not even true epilepsy. Psychogenic from the head, psychogenic, psycho. Okay, and there is true epilepsy. So I need to know if you have somebody and having some kind of events like that, I want you to film the attack and focus on the eye. Drooling or no drooling, the teeth, how is the condition of the teeth? Both sides are trembling or not, or just one side, and how long does it last? Okay, that's very important for me to give good information to the doctors who will be able to evaluate, because epilepsies are kinds, and among which the spiritually induced epilepsy, okay? Like this case has something to do with the spiritually induced, right? And also, you can see the drooling, so she has the attack. But the question is, when she fell, why did she fall like this? Like she was careful not to hit her head. So that's the question, eh? Because if you have true epilepsy, you will fall anyhow, like not in a protective position. Oh, I don't want to hit my head, so that's why I'm having my elbows like this to protect my head. That is not true epilepsy. That is not true epilepsy. Because if it was true epilepsy, she will fall, boom, she will hit the ground, and in the position where she was standing. She will collapse right there. No, not in a protective position and not with the eyes open. Okay, so that makes a lot of difference to your specialist. He would know how to categorize the disease. It seems like, we have not discussed this very much, but it will be a totally different topic about epilepsy and seizures and convulsions and what kind of seizures we can get. And the most important advice from me as a physician here is to make a videotape and focus on the face and on the eyes. Are they open or they are closed? How long does it take? Does the patient remembers the events before and after, or doesn't? So I ask her after this event, the patient doesn't remember. So that means something to me in my diagnosis. Now, there is one thing I want to mention in the last 2 minutes here, very essential. Some of us are financially, unable. We don't have the money, like this kind of patient here. She doesn't have. I barely give her an injection and a sachet of medication till she cannot afford the price of the medication. She needs some investigation to be done. She cannot afford. So my call here, for those who are financially blessed, if you can contribute to help sponsor somebody like this, you'll be blessed. You'll be blessed. So anybody, we have a list of them that they are financially disabled. Okay, and they need help. We help as much as we can. My consultation is free. It has always been free. My first ultrasound is free. It has always been free. Okay, but there is also people out there that like to help people and they don't have the opportunity. Here we are. We offer you the opportunity. Come and visit us, sponsor a patient or two, and God will bless you by helping others. Okay, there are really some people in deep need that if you've blessed, please, you can help. Thank you very much for today's session, and I hope you learned. And if you have any questions, you can send me WhatsApp. I answer all the questions. I group them up and I talked about them as a general topic. And you have a very nice and beautiful weekend. May God bless you all. I'll see you next Saturday, 5 o'clock. Thank you.